Very much, Christine. It's very great to be here and talk to you all. The field of air quality and air pollution is one that's fairly new to me. I've been working in environmental social science for about 10 to 15 years, but my expertise has been in climate change, social science, whether that's behavioural, public understanding, communicating climate change, and so on. But for reasons that I hope will become apparent during the course of my presentation, we as a group of researchers where I work and in my field are increasingly thinking about and paying attention to issues around air quality and air pollution. So I will just share my screen. Now, let's see. If I do this, okay, the question then becomes: can you see the presenter view or the audience view?
We've got the presenter view, so if you could just go to display settings and put.
Yeah. Okay.
Great, thank you.
I'm just there. It's just my computer's struggling to make it happen. There we are. Oops. Swap.
Great, thank you. That's showing as as the right view now. Yeah, thank you.
Okay, and I will minimize myself. Okay, so hopefully without further ado, I can continue. So hello everyone, I'm Stuart Capstick. I'm Deputy Director of the Centre for Climate Change and Social Transformations, or the CAST Centre for short. And Christine very kindly asked me if I'd like to come along and talk to you all. I met her virtually at a seminar that was given jointly, I think, by the Met Office and the Strategic Priority Fund. It's sad in many ways that I am here speaking when Martin Williams was due to do so. I didn't know Martin well, but I had been getting to know him a little bit over the course of this year, and I know he was very interested in the sort of social science side and perceptions and lifestyle. So I hope that what I'm going to talk about is of interest in that way. So I'm going to talk you through a few things. First of all, I'll say a little bit about the CAST Centre, because a lot of the research and ideas that I'm going to present are grounded in the context of that centre and the sorts of research we do. I want to try and draw together some threads of how research on climate change, social science links to the sorts of things we might be concerned about in relation to air quality. I'll do that in a slightly more specific way when I speak about public understanding of environmental issues, including climate change and air pollution in the context of risk perception. And I'll also talk a little bit about some of the theory and practice of lifestyle change. I used to say behavior change and talk about behavior, but increasingly the word behavior sort of seems to be a little out of fashion, and for good reason, I think, because behavior is a very individual thing that implies it's very grounded in entirely our own sort of choices. So we tend to talk about lifestyle change these days. I'm going to say a little bit about the impact and the wider context of COVID-19 and lifestyle change. And then I also want to sort of touch on some of the emerging work that we've got underway as part of the CAST Centre to sort of give an illustration of the sorts of ways that we could think about researching and rolling out some of the ideas that I'm going to talk to you about. And then I'll just briefly mention some potential future directions, gaps in the research, and so on towards the end. So the Centre for Climate Change and Social Transformations, this is a bit of a logo-tastic slide, but you can see there some of the many organisations and institutions that we are linked to. The bigger logos are the main university sites where we are based, as well as Climate Outreach, which is a smaller NGO who is very integral to the CAST Centre. So we have, for a social science centre, a fair old chunk of funding. We've got £5 million UKRI funding for 5 years. We started the centre May last year. Of course, couldn't possibly have anticipated what was going to happen in 2020. So it's been a fairly strange time for us to be getting a large centre up and running. but as with everyone else, we are trying to persist in doing so. We have a number of partners, as you can see at the bottom here, across the private, public and third sector. So we're working with some NGOs, some business, and some national and devolved government as well. And the core kind of aim, the core question for us as a centre is how can we as a society live differently and better to achieve systemic, deep and rapid emissions reductions. So the CAST Centre was born out of a recognition which is a sort of a longer standing recognition within the Tyndall Centre for Climate Change Research, which many of the institutions and people involved in CAST are linked to, that in order to properly address climate change, or to address climate change at the scale and with the rapidity that it warranted, we needed to do a lot more, to move more quickly and to move in a more sort of fundamental systemic way. And as someone who's worked in kind of behavioral science approaches, I personally felt a sort of a frustration with much of the research, which seemed to be sort of tinkering at the edges. And so when we put in a proposal to have this research centre, we were very definite that we wanted to think about deep and rapid emissions reductions. Easier said than done, of course, but our rationale for doing that was linked to these 4 areas, which I'm showing on the slide here: food, heating and cooling, home energy use, mobility, and material consumption. And the reason that we chose to focus on those 4 areas is firstly because each of them are significant in terms of carbon emissions or equivalent carbon emissions in the case particularly of food, but also that in terms of reducing emissions in these areas, it's proven difficult. I hope that's not in the way. Yeah, it's proven difficult to do that. So we have seen emissions reductions in the UK over time, but these areas are kind of quite intransigent in that sense. Now, we are interested in the sort of social science of this, in people's relationship to change, and so we're very interested in values, which relates to the things that matter to people, things that people are concerned about, their preferences, etc., as well as co-benefits. So this is part of the question here about living differently, is that this shouldn't just be about cutting our carbon emissions. It should be about having better ways of life, better communities, better ways of working, etc. So that's a sort of another slant we have. And we're very interested in people as agents of change. So when we are thinking and talking about social and behavioural change, we're very keen to note that this is not just about consumer choices. Consumer choices matter, but people are much more than consumers as far as we're concerned. And so we're interested in individual and collective action across a range of contexts and roles. That might be people as members of households or communities. It might involve some political or public sphere action, etc., etc. And we're interested in how people's choices and lifestyles relate to both direct and indirect emissions reductions. Now, we're a cross-disciplinary social science centre, and so our areas of focus span everything from kind of individual level up to the national and international level. So my background has tended to be in psychology, and so that tends to have quite an individual focus, how you get people as individuals to behave differently. But we recognise that there are many interactions between these different levels, between the individual, the community, organisational, city and national, international level. So we have people working, policy experts and political scientists working in the centre as well. We have 4 themes which can be divided up as follows. The first theme is about visioning, imagining different versions of the future. And this asks, what could low carbon transformed futures look like? And so we know the situation we're in now, we know we need to cut emissions, but what sort of society is it that we want to be heading towards? Some of the work we're doing here is quite quantitative, involving scenarios and modelling, but we're also doing public deliberation work, getting members of the public together to sort of talk through with them what a better future society could look like. So it's kind of more aspirational future visioning. We're also looking at how transformations have occurred in the past, whether government-led or whether more bottom-up and sort of cultural shifts. And as part of that, there's a no smoking sign there. Often an analogy made with addressing climate change and other problems is smoking, and how a kind of a whole suite of policies and interventions over time have finally led to smoking rates being cut. So we're trying to learn those lessons from the past. We're also trying to get out there in the world and apply some of these insights. So the third theme, trialing, is the one that I co-lead with Professor Wouter Portinger at Cardiff University. And so we are looking at working with various people and organizations out in the real world to trial interventions. And I'll talk a little bit about a couple of those later on. And then more broadly, we want to understand how the sorts of lessons we are learning and our research can be upscaled and embedded within society and across policy. Okay, so I hope that's given a rough introduction to the CAST Centre. I'm going to talk a little bit now about some of the specifics of perceptions and lifestyle change. But I think before moving on, it's useful to ask why these things matter in the first place. So my understanding of much of what people involved in IAQM do is that you measure and monitor and observe and keep track of kind of air quality, air pollution, and so on, which is clearly very important. Now, it's ultimately, you might argue, it's the level of pollutants in the air, for example, which matter. Why does it matter what people, how people perceive this? Well, I think first of all, if we just define risk perception as the nature and level of concern that people have about a problem, how much a person thinks or feels as a risk from something like air pollution. Now, this may or may not correspond to objective reality and measurements, but it's people's perceived risk that can affect their personal action and policy support. So to give an example, I may not think that smoking cigarettes has much risk to my health, and so I smoke. Whereas if I think it does pose a great risk, I don't. So in many ways, in terms of whether people support policy or are willing to make changes in their lives or are willing to accept changes in their local area, etc., it's going to be down in many cases to whether they perceive there to be a risk and an issue. And so this links as well to how we live, especially in the rich world. Now, there are a sort of series of interlocking issues. I have primarily tended to be interested in climate change, but increasingly interested in other environmental problems such as air pollution, resource depletion, etc. And the tricky thing is that, and one of the motivating factors of why we were able to set up the CAST Centre is that actually many, or arguably most, of the emission cuts that we have seen over time in the UK have been rather behind the scenes. So this figure on the right here comes from a report a couple of years ago from the Committee on Climate Change. And you may have heard the figure often quoted that the UK has cut its carbon emissions by 40% since 1990, which sounds great, and it is good. It's better than zero. But most of that has come from this red line here on the screen, from changes to energy efficiency, changes to technology and energy supply. What we now find ourselves in a situation is that there is still more that can be done with that, but that actually it's being increasingly recognised by the Committee on Climate Change and in policy as well, that if we want to get further, if we want to get to net zero, this is going to require some genuine and far-reaching social and behavioural change. Now, I think this applies not least to transport, which I think is an area which is very relevant both to climate change and air quality. You can see again on this figure that transport emissions are now the highest sector as the Committee on Climate Change measures this, and they haven't changed much over time. I mean, this is carbon emissions, so there may be different ways of framing this depending on your measurements, but certainly in terms of carbon emissions, this hasn't changed much over time. So we need to think seriously about social and behavioural change. So in terms of risk perceptions, are people concerned about climate change and air pollution, and to what extent are they concerned, and why or why not is this on their radar? Well, in terms of climate change perceptions, there are actually at the moment pretty high levels of concern and awareness about this issue, and even despite the upheaval from the pandemic. So research that we did last year and this year using public surveys found that around 3/4 of people in the UK think that addressing climate change requires either a high level of urgency or an extremely high level of urgency. And this is this sort of level of concern that we have seen in the last year or two is pretty much unprecedented. So some of the work I've done in recent years has actually looked at change over time in public concern about climate change, and it tends to fluctuate. It may rise during periods of heat waves or extreme weather. It may fall during times of economic hardship, and this applies in different parts of the world. But what we've seen over the past couple of years is a change that we haven't seen up to now, and that is that levels of concern have reached new peaks. When you come to air quality perceptions, there is public concern about this. People do perceive it as a risk, but I mean, this is not an exactly comparable measure, but I think it's fair to say that there is not quite such the salience in public risk perceptions about air pollution. So about half of people in England are concerned, and about half are not concerned about air quality and air pollution. And people would, when asked, would say that cars and lorries and vans are the main causes of concern there, and perhaps not surprising. But household sources, of which I think this is DFT data, put together quite a number of sources, including barbecues, I believe, and home cleaning products, etc., was not recognised by many people as an issue. So you can see here just a sort of graphical illustration of this, about 50-50 concerned or not concerned about air quality. And this varies by location. Again, perhaps not surprising that people in urban conurbations, cities, towns are more concerned about this, and that is the case. And I think it's useful to sort of put these issues or put these problems into the context of a wider range of social issues. So when we did some social research this year, I think it was May to June 2020, the public survey, this is a survey of approximately 1,500 people in the UK, nationally representative. We found, not surprisingly, given this was in the middle of the first lockdown, that coronavirus was pretty much top of people's concerns. So a large proportion of people were very worried or extremely worried about COVID. But sort of to our surprise, really, we had been thinking, in fact, in relation to quite a lot of theory around risk perception, we had expected that climate change and other issues might have fallen away. But actually, climate change sort of has held its own in terms of a public concern. Air pollution is there, but it seems to be, so these choices are sort of ranked by order of extreme worry, if you like. So air pollution is there, but is not quite such a prominent concern as some of these other issues like plastic pollution and wider ecological concerns. Okay, so we know that perception of risk varies. The next question is to ask what influences risk perception. So I've mentioned how this can change, vary over time. And there are a number of sort of traditions of research in the risk perception literature. I had initially planned to talk through quite a number of these, and then I realized it would take me a very long time. So I've sort of drawn out a couple of the more influential and sort of illustrative ways in which risk perception research has been done. What's called the psychometric paradigm has been very influential over time, and in fact the risk perception literature sort of began with this sort of approach back in the, or probably 1970s, 80s. And the psychometric paradigm essentially refers to an emphasis on measuring the person, so psychometric. And the idea of this is that people's risk perception is grounded in their cognition, their emotion, their thinking, their understanding. It is a personal, it's a personal individual thing. And the reason why this research began in the first place was to attempt to close the gap between what was recognized as often expert understanding of risk and lay perceptions. So there is the sort of measurable, objective, statistical version of risk versus the kind of subjective, felt version of risk. And the not unreasonable sort of rationale for doing this sort of work is that kind of lack of knowledge or sort of misperceptions about risk can lead to poor choices. And this has been termed the deficit model. It has been critiqued because many people will argue that often the ways we do things and make the choices we do are not always or not necessarily grounded in what we know about an issue, but nevertheless, that was the kind of basis of the psychometric paradigm. And one of the sort of key things to have come out of this literature is that people's perception of risk at the individual level hinges on the extent to which a hazard features an element of dread and an element of being unknown. Now, these are both sort of shorthand terms for a variety of sort of features of risks, but they tend to cluster together when you measure people's risk perceptions. And so dread is essentially shorthand for feeling that a hazard has a lack of control, that it could be potentially fatal or dangerous. And the unknown dimension is the idea that a hazard is unobservable, new to science, it may be unfamiliar or longer term. And the sort of the difference here might be the difference between a risk perception of radioactive waste, which seems quite to have quite a strong element of dread, versus car driving, which is a pretty everyday. There's nothing particularly dreadful about driving your car around, but of course, by some readings, the latter is more risky. And it's been argued that I mean, there's not a huge amount of literature looking at risk perception of air pollution. But Karen Bickerstaff, who is someone who has done a certain amount of research in this area, has argued that because air pollution is more visible, more familiar, and of known consequences, and with more immediate effects, it therefore doesn't have very high qualities of dread or unknownness. And so that may be one of the reasons why people tend not to have strong concern or high risk perceptions about air quality. Now, as I mentioned, others have sort of pushed back a bit against the psychometric, the individual measurement of risk perception, and have said that actually, yes, risk perception is subjective, but it's also grounded in our everyday life and context. And this can include a number of things, but one of the most prominent is our locality, where we live, and our sense of place. And there's been some interesting research looking at people's perception of outdoor air pollution and how this is linked to locality and place. And this sort of research has found that people's awareness and concern about air quality or about air pollution is strongly linked to the physical senses, the sense as to whether that you can see, whether there is visible smog or smoke or dirt, even taste and smell, and that actually the sort of the things that come to us through the physical senses are key here to driving risk perception. Also, personal experience in terms of people's health systems is important. And there's related research in this area suggesting that for people who have a strong sort of attachment and commitment and affection with where they live, they will tend to have quite low risk perception of air pollution, as opposed to those who don't have that sort of commitment to a place. So that's just a couple of illustrations of how risk perception might form. Following on from the idea of whether people perceive a risk, is the sort of next logical question is whether people are likely to do anything about it. So one of the things we're interested in our research is what determines whether and how people act on environmental problems, including air pollution. And now there are a number of sort of theoretical frameworks that look to explain this. I'm not going to go through more than one because I felt that it would be good to just illustrate this with one model. But this is one of the most kind of influential. It's a pretty simple model of action, but it's been widely applied in the behavioral domain in relation to environmental problems. It's called the theory of planned behavior. And the idea of this is essentially that people's attitude, their subjective norm, and their perceived behavioral control influences whether they intend to act, whether they plan to act, hence the name of the theory, and that in turn affects their behavior. Now, in this model, attitude has a sort of specific meaning. It means one's how you see behavior in positive or negative terms. So you might see something as appealing or repellent or exciting or boring. It's essentially the positive or negative aspect with which you view a behavior. A subjective norm is whether you feel like you should be doing something or not doing it in a social context, and perceived behavioral control is about whether you feel you have any actual control over the behavior. So if we apply this to a sort of common everyday problem, which can lead to poor air quality, just a particular thing, but in the case of idling, in the case of sitting in a car with the engine on, you might describe this in terms of the theory of planned behavior in the following way. Do I view idling in a positive or negative light? If I think it's a bad thing to do, a negative behavior, then I may not do it. If I may not think about it at all, I may not have a positive or negative view, in which case it will have no influence in terms of my attitude. I may feel that people disapprove of me idling. If I feel that there is a subjective norm against me doing it, that will influence whether or not I do it. And then the third point, can I do anything about idling? Well, of course, it's easy to switch your engine off, but there may be reasons why you want to leave it on. You're about to leave the car, you want the heater on, for example. But all of these things influence whether you're likely to want to turn your engine off and then whether you actually do it. Now, how do you apply something like this? There was a very interesting study that was done last year in a city in, it says in the paper, the north of England, so I don't know which city that was, but there was an intervention study in the north which tried to apply this theory of planned behavior framework to influence people's actual idling, whether they sat there with their engine on. And the way they did this was to use different signs at a level crossing. So a level crossing is obviously a good location to test this out. People pull up, the barriers go down, they either sit in their car with the engine on or they switch their engine off. And so these researchers use different types of messages. They use an attitude-linked message. Please switch off your engine, you will improve air quality in the area. So it's taking this action essentially is a positive, a good thing. The norm-linked message emphasized that other people had a view or that it mattered to other people how which tried to emphasize the sort of the actual thought process immediately before you turn your engine off. Are you actually going to do this? And then there was a baseline condition with no message. And these authors actually found a pretty strong effect, particularly for the attitude-linked message, but for all of the messages that related to the theory of planned behavior, they found significant effects. I think actually with this study, it would have been good to have a separate baseline which said, please switch your engine off. That would have perhaps been more of a true control. But it certainly shows that if you think about the features of the theory of planned behavior, then it can influence how people act. Now, sort of almost contrary to that message, the theory of planned behavior has proven useful in developing interventions to change people's behaviour in the environmental domain, but it's also these sorts of approaches have also been criticised because much of what we do, much of how we live, is actually down to our habit and our routine. So I've given the example of idling at a level crossing. Conversely, we might say, and some people do that, actually, when we drive, this is normally just, we drive because it's something we always do. Take the case of commuting, prior to the lockdown, at least, whether people kind of got in their car to drive to work or not, was probably, and there's research to support this, as much due to whether that's something they had always done, it was just the way they went to work, as to whether they sort of directly every single morning considered, now how shall I get to work today? And the argument here is that habit and routine leads to tunnel vision, that when we are in a routine, when we undertake habitual behavior, then we tend to ignore information, we tend to ignore sort of carefully thinking through and deliberating on other ways of doing things. And that habit and routine can effectively work against the effectiveness of information campaigns. And this may be one reason why, despite the sort of the best intentions of information campaigns on things like idling or how we drive, that's going to be sort of impeded by the fact that much of what we do is habitual. However, there is a sort of a chink in the armor of habit, which has been called the habit discontinuity hypothesis. And that's that sometimes our habits are disrupted by particular events or decisions. And when there is disruption, then that sort of targeted information can become more influential. Now, typically, that's been looked at through things like people's relocation, moving house, or changing job, or as shown in the picture in the bottom right here, simple travel disruption if there are major roadworks. So these sorts of events will disrupt or have the potential to disrupt habit. And there's been research looking at this, actually doing this. So the following study back in 2006 by Sebastian Bamberg looked at whether moving house could be used to disrupt people's habits. And what this researcher did was to give tailored information on public transport in an area and a bus pass that people could use for free to promote PT as public transport, to promote public transport, either for people who had just relocated, just moved house, or not. And as you can see from this slide, for the people who had relocated, giving that bus pass and that information to people just after they moved house was very effective for promoting public transport use. So these sorts of behavioral techniques can be very useful, but they work best if they're targeted at particular times. Which brings us, of course, to our current trying circumstances. We are in a current circumstance where many things are disrupted, not least our working practices. When we set up the CAST Centre, we were talking about all sorts of things. It's interesting to look back, and we were talking about, well, what sort of national events might happen that would disrupt the way we live our lives. And we kind of had Brexit on our radar. We were thinking, well, early in, if and when things are resolved, however they're resolved, this may lead to various upheaval for how people work, etc. We couldn't have anticipated COVID, but anyway, it's happened. And so this has led us to do some research on this. And so we've published this briefing paper a couple of months ago. You can find it on our CAST website. And some of the lessons from COVID, and I'll look at this in a little more detail after this slide, is that our habits and our routines, we know they depend on our wider conditions, where we live, the times, the people we're in touch with, and that the pandemic has been a major disruption to those conditions. So we ran 2 surveys, one in May of this year, which was a nationally representative survey, and the other we ran at the same time, but we wanted to get more sort of detailed responses from people. So this wasn't nationally representative, this was a bit more open-ended. and qualitative. And I'm going to talk you through a couple of the findings here now, and with a couple of suggestions for what this might tell us about behaviour change. So first of all, we found that actually people's experiences of working from home during the lockdown had been pretty positive. Bearing in mind this was May of this year, it's been a few months since then, and so that effect may have worn a bit thin. But for the most part, of those people who were working from home had found this a very positive experience. And as a consequence, hopefully you can see some of the text here. There was an intention, a much stronger intention among people to keep doing more of this than to work from home less after the lockdown. So what we identified in this research in May was that among those who are working from home, who are having virtual meetings, GP appointments, etc., there was an intention among people, and you remember intentions are important for the theory of planned behaviour. There was an intention to do a lot more of this after lockdown ended. The other side of the coin, in terms of sort of environmental impacts, is that people tended to, there was a stronger intention to use public transport less, presumably because of sort of health concerns. But at the same time, people said they intended to fly less for holiday or leisure purposes, which I think is important for carbon emissions apart from anything else. Now, some of the qualitative responses we got from people, these aren't intended to sort of represent people's experiences overall, but I think just to sort of illustrate the sorts of reflections we got from people, people talked about wanting to spend more time in the garden, exercising, growing vegetables, repurposing things, and being careful with what they have. And this was something we did get through from the research, that actually, we hear this sort of in the news and so on, that for some people, for many of us, the pandemic experience has been one with some positives, that we've at least been able to reflect and think about some of our practices. And this does seem to have been the case for many of the people in the survey. And again, just to sort of return to this point about climate change concern, we were genuinely surprised to see that, if anything, climate change concern had gone up during the pandemic. So in August 19, so the darker bars here, we ran a survey in the summer and found what we thought at that stage was pretty high levels of concern about climate change. But actually this year that's even gone up, and we're still sort of puzzling over why this might be. My feeling is that there is a sort of conceptual link between the two things. Now, as to whether the coronavirus and coronavirus spread, how that is and isn't linked to climate change and wider ecological disruption, is a very complex issue. But I think that what this sort of finding tells us is that these sorts of things are being linked. The idea that the sort of stable circumstances that we have tended to assume are enduring in the past are sort of being brought together in terms of how people recognize that there are threats to those. I mean, that's my take on this anyway, that these issues are actually being linked. But in terms of sort of what we do with these kind of lessons and how the sort of habit disruption idea works here, the key thing is to lock in desirable behavior changes. Now, we have seen, what we did see after the first set of lockdowns was eased, that traffic began creeping up to some pretty high levels. In Bristol, the city I live, it reached near pre-pandemic levels. That might have partly been because people were avoiding public transport. But the key point for sort of locking in behaviour changes is to make those sort of structural shifts in order to sort of consolidate those. And just to give one example here, this is Bristol Bridge, where I live. It's been a site of many arguments in the city as to whether it should be a kind of a route for traffic to thunder over the river into the city. But one of the things that has happened as a result of the lockdown was that the council temporarily closed this in order to enable more walking and cycling, and that there are now moves afoot to sort of maintain that. So wherever these positive behaviour changes can be locked in, sort of now is a very good time to do that. I've got a few minutes left, so I want to sort of talk a bit more about some of the current CAR Centre projects, because I think they may, I hope, broaden out the presentation in terms of the wider sorts of research we can do to look at how people understand and respond to climate change and related issues like air pollution. One of the projects that's about to get underway is one on public deliberation. Some people on this call may have encountered the UK's Climate Assembly earlier this year, finished earlier this year, which involved members of the public being brought together, about 108 members of the public, to talk about how we address climate change, what we do about it. And we're doing something kind of similar soon. The point of this sort of work is to ask people what sort of future social transformations they would like to see in order to have a net zero or a 1.5 degrees C consistent society. We can kind of try and impose all the sort of technological or policy measures we like, but we're likely to find resistance from people if this isn't done as much as possible in a way which is aligned with what people want from a future society. So what myself and some colleagues are about to get underway is some in-depth deliberative work with people to talk with them about what sorts of changes they'd like to see. And I've shown some of the materials that we're going to be using here. So these are sort of intended to provoke people's thinking and reflections and discussion around, do we want to travel less? Do we want more public transport? Should we be setting up our societies for more active travel? Do we want to use electric cars or downsize our cars? So these are the sorts of future-oriented discussions we're planning to have. In terms of a sort of an immediate behavioural level intervention, we're working with a small NGO based in London called Possible. They used to be called 1010. And what they've been trying to do is to sort of exploit the current opportunity we have where people are walking and cycling more, striding and riding, to actually design an intervention and encourage people to do more of that. So there's a combined sort of pledge to do this campaign, as well as a campaign to get people to pressure and contact policymakers on this. And as you can see from the Stride and Ride 5, the aim of this is emphasises multiple benefits for walking and cycling more, keeping public transport safe, keeping our air clean, maintaining our health, etc. So at the moment, we're currently measuring and monitoring this, and we're wanting to see whether how successful this has been and whether people are taking this up. We're doing city level interventions with Greater Manchester Combined Authority. So I mentioned that we do work at the individual level, also kind of community level campaigns, but ultimately many of the sort of structural and infrastructural changes that we need are going to happen at the national and regional and city level. So researchers, particularly those at Manchester, I should say, are working to both quantify what emissions levels compliant with the Paris Agreement would look like, how to get there, and to also identify the range of co-benefits for climate action in terms of health, well-being, and active travel. And you can see again there, this is a screenshot from the council's sort of report on how to do this and what they're doing. It brings together considerations around zero emissions alternatives, active travel, etc. And the final sort of piece of work to highlight that I'm working on at the moment, which will be published in either 2 or 3 weeks' time, is the United Nations Environment Programme's Emissions Gap Report. So this is a report some of you may have encountered before. It comes out every year. And every year it's a sort of stock taking exercise to say, how are we getting on as a planet at a country by country level in terms of either reducing or at least leveling off emissions in order to tackle climate change. And for the first time this year, we have had the opportunity to be part of this report by writing a chapter on lifestyle change and behaviour change. And in doing that, we've been very keen to sort of draw links between, as shown in this diagram with the circles here, draw links between sort of the personal and immediate, as we've called it, things to do with knowledge and information, behaviour change, habits and routines, to link that with the social and contextual, the things that are at one level above the personal and the immediate. So we're interested in things like citizen participation, social norms, media, the information environment, as well as the structural. So the much higher level things like policies, economics, infrastructure, and so on. So I mention this mostly to sort of highlight that this report is coming out soon and that we do have a chapter on lifestyle change and to refer to some of the sorts of things that we're talking about in there. So I won't go through all of these examples in the box, but again, if we're interested in lifestyle change and behavior change, then in some senses that might be down to policies and interventions targeted at the sort of personal individual level, so habit disruption, attitude awareness, social norms, but also lifestyle change is very important to recognize is to do with things like transport infrastructure, legal frameworks, etc. So personally, I was very pleased to hear finally that the government is going to be banning petrol and diesel cars in 2030, because that sort of really sets up the legal framework and the wider expectations for change in how we travel. So this is pretty much my last slide. I was thinking about what are some of the areas for further research where maybe there hasn't been that much social science research, or where we could develop this further. I think I'm quite passionate about the idea that we will get further if we can integrate the sort of different disciplinary insights, whether that's to do with health, action on climate change, making better communities, as well as concerns about acting on air quality. I think it's important to engage citizens with this, and that can risk sounded like a bit of a platitude, but I think there are ways of doing that practically by having much more sort of focused and structured ways of thinking through these issues with people. What sort of changes do people want, and would they be happy with? Indoor air quality was mentioned by Christine at the start. To my understanding, and I have tried to look into this, there is very little work in environmental social sciences, environmental psychology on indoor air quality. There's one or two studies, but I think it's an area which is sort of ripe for research. If this is identified by the experts in air quality as being an issue, then I think we need to be finding ways to look at how households themselves understand this topic. And yeah, there are plenty more behavioural and beyond ways of looking at interventions for low emissions transport. So I'll finish there with a thank you for listening. The CAST Centre website is there. We have a Twitter handle. That's my Twitter handle, and I've sort of thought pieces that I have either led or been involved with other people on, thinking about how social. Okay, I will stop sharing my screen if I can, which has got a stop button, and happy to take any questions. Thank you.
Absolutely. Thanks, Stuart. Thanks very, very much.